Welcome to the GMJ podcast, the official podcast of the Georgian Medical Journal.
In this series, we present structured discussions of peer-reviewed contributions published in GMJ, examining their implications for clinical practice, medical education, and health policy.
This episode reviews the article titled, Evaluating the Normative and Educational Influences of Public Health Policies for Non-Communicable Diseases.
And it's a piece that really challenges how we look at the data.
It really does. So to kick off this deep dive, I want you to think for a second about a choice you made today. Maybe it was, choosing a bowl of plain oatmeal over a glazed donut, or deciding to take the stairs instead of the elevator.
Right, the classic daily decisions.
Exactly. And it feels entirely like your own independent choice, right? You weigh the options and you made a decision.
Yeah, that's what we all like to think.
But what if those seemingly spontaneous choices were actually the result of a decades-long invisible curriculum? A curriculum designed to teach you exactly what to prefer.
It's a profoundly unsettling concept to grapple with, honestly. I mean, we naturally want to believe we are the sole authors of our daily habits.
Right.
And we like to think that our health outcomes are just the sum total of our personal willpower.
Well, that illusion of total independence is exactly what we're unpacking today. We're taking a deep dive into this fascinating new piece of research published in the inaugural 2026 issue of the Georgian Medical Journal.
That's Volume 1, Issue 1.
Right, and the paper is by an independent researcher named Owen. He is taking aim at something massive here.
He really is. He's looking at the way governments and global institutions evaluate public health policies.
Specifically, policies designed to prevent non-communicable diseases, or NCDs.
Yeah. So just to set the stage here, non-communicable diseases are the chronic conditions that aren't passed from person to person.
So we're talking about things like heart disease, type 2 diabetes, various cancers, and obesity.
Exactly. Unlike a viral outbreak, you don't catch an NCD on a crowded subway.
Thank goodness for that.
Right. These diseases develop slowly over time. It's largely a result of prolonged exposure to specific environmental factors and behavioral habits.
And because they develop so slowly, combating them requires these massive structural public health interventions.
Which brings us to the central research question of this deep dive.
Okay, let's unpack this. Usually when a government rolls out a health policy, let's say a steep tax on sugary drinks or mandating like aggressive graphic warning labels on junk food, we judge the success of that policy by looking at the immediate data.
Right, the short-term behavioral effects.
Yeah, we want to know if it changed people's behavior right away. Like, did the sales of soda drop this quarter? Did people stop buying that specific candy bar the week the tax went into effect?
And that demand for immediate data is actually the global standard. Thomas points out that organizations like the World Bank and various national health councils explicitly design their evaluation metrics around that short-term data.
It's all about the immediate impact.
Exactly. If a country implements a tariff on imported ultra-processed foods, the primary measure of success is the quarterly import data.
Or if a city bans artificial trans fats in restaurants, they measure the immediate drop in trans fat consumption over the next 6 months.
Right.
It sounds like we're treating complex public policy the exact same way a person treats a crash diet.
Oh, that's a good analogy.
Like you starve yourself for a few days and you step on the scale every single morning looking for an immediate drop in weight.
Yeah, but any nutritionist will tell you that a crash diet fails because it doesn't build a long-term sustainable lifestyle change.
It just shocks the system temporarily.
Exactly. And that crash diet mentality demands instant gratification, which, Thomas argues, is incredibly dangerous when applied to public health.
Because politicians want to see a rapid return on investment to justify the policy to voters, right?
Yes. But by hyper-focusing on that immediate behavioral data, Thomas says we are completely missing the actual mechanism of change.
So it's his core analytical argument.
His thesis is that public health policies shouldn't be evaluated merely as short-term behavioral modifiers. Their true function is to act as long-term educational tools.
Educational tools.
Yeah. Over the span of decades, these policies fundamentally reshape our social norms and ultimately our very sense of personal autonomy.
But I have to push back on this timeline a little bit.
Sure.
If a government agency realizes a specific chemical is causing a massive spike in heart disease, they don't want to slowly educate the public over 40 years. They want people to stop eating it today.
Right. The immediate threat.
Yeah. Like if your house is on fire,
Yeah.
you don't sit everyone down in the living room to teach a class on fire safety. You grab a high-pressure hose and you put the fire out immediately.
Well, if the house is actively burning, you absolutely use the hose. Thomas isn't suggesting that short-term behavioral interventions are useless.
Okay, good.
The immediate mitigation of harm is necessary. However, evaluating the policy solely on whether it put out the fire is an incomplete metric.
No.
Thomas argues that the hose doesn't just extinguish the flames, it leaves massive water damage behind.
Oh, I see.
And that water damage serves as a permanent, highly visible cultural warning to the next generation about the dangers of playing with matches.
Wow. So the intervention itself fundamentally alters the environment long after the initial crisis has passed.
Exactly.
So the policy is leaving a permanent mark on the culture. The paper uses the phrase normative and educational influences. Break down that word normative for me in this context. We're talking about defining what society considers normal.
Precisely. We have to look at the psychological mechanism of how a society learns what is acceptable. We're highly social creatures, right?
Right. We take our cues from our environment.
Yeah. So in the short term, a policy might use a blunt financial penalty, like a 50-cent tax on a soda to deter you from buying it.
That's the behavioral nudge.
Yes. But over time, the constant, everyday presence of that policy creates a continuous friction. It alters the landscape of the grocery store. It changes the cultural conversation around the dinner table.
It stops being just a financial penalty and starts becoming...
A moral judgment from society itself.
Exactly. And that's the educational component.
Right. The policy slowly educates the public consciousness. Fast forward 20 years, and the next generation doesn't avoid the sugary drink simply because it costs 50 cents more.
They avoid it because their environment has successfully taught them that consuming it is not a normal, acceptable part of a healthy lifestyle.
Yes. The mechanism of the policy shifts entirely from an external financial hurdle to an internalized social norm.
What's fascinating here is that noticing that shift in social norms leads us straight into one of the most powerful historical examples in the paper.
Oh, the smoking example.
Yeah, to really understand how a policy rewires a society's brain over a generation, Thomas cites an incredibly telling study in his bibliography. It's reference 5.
Right, the 2022 study by Dai, Gakadu, and Lopez.
Exactly, titled Evolution of the Global Smoking Epidemic Over the Past Half-Century.
The history of the global smoking epidemic perfectly illustrates the mechanics of this long-term educational shift.
It really does.
I mean, if we rewind the clock a half-century, back to the 1970s, smoking wasn't just a common habit. It was a deeply entrenched social norm.
It was actively associated with glamour, sophistication, and relaxation.
Yeah, you'd watch a primetime talk show, and both the host and the celebrity guest would be casually chain smoking right there on camera.
People smoked in offices, in crowded restaurants, and even in hospital waiting rooms.
Which is wild to think about now, but that ubiquity created a massive social proof loop.
Social proof.
Yeah, human brains are wired to look at the herd to determine what is safe. If a child sees every successful, respectable adult in their life smoking indoors, their brain automatically categorizes that behavior as safe, normal, and desirable.
So when public health officials realized the catastrophic cancer risks and introduced the very first wave of anti-smoking policies.
Like the early cigarette taxes and the first localized indoor smoking bans.
Right. Those policies functioned purely as short-term behavioral nudges.
And the public reaction was intense. People were furious about those early indoor bans.
I remember hearing about that. They didn't suddenly experience an epiphany and stop wanting to smoke.
No, they were just deeply annoyed that they had to take their cigarette outside into the freezing rain. The underlying preference to smoke remained entirely intact.
So the initial policy was just a physical barrier, a hose putting out the immediate fire of secondhand smoke in a specific restaurant.
Exactly. But over the course of the 50 years analyzed in that study, something profound happened to the cultural psychology.
By forcing smokers to step outside, the policy effectively removed the visual cue of smoking from daily indoor life.
It broke the social proof loop.
Shattered it.
Yeah, a child growing up in the late 1990s or the 2000s experienced a completely different environmental curriculum.
They didn't see glamorous adults smoking at dinner. They saw people huddled in the cold in designated smoking areas.
They saw graphic warning labels on packaging. They experienced a world where cigarettes were locked behind counters and heavily taxed.
So the policies didn't just stop people from smoking in the moment. They fundamentally rewired the brain's association for the next generation.
Right. Smoking transitioned from a glamorous adult behavior to an isolated, inconvenient habit.
Just visualize the sheer scale of that psychological shift. Imagine you're on a crowded commercial airplane today, flying at 30,000 feet.
Okay.
And the person sitting in the middle seat next to you just casually pulls out a lighter and sparks up a cigarette.
Oh, wow. The reaction from the other passengers wouldn't just be mild annoyance, it would be absolute panic.
People would be hitting the flight attendant call button frantically.
Yeah.
It would feel completely alien, almost aggressive.
Yeah, definitely.
And that visceral, gut-level reaction, that immediate feeling of this is deeply fundamentally wrong, that didn't happen by accident.
No, that is the long-term educational impact of public health policy in action.
We don't need a short-term nudge or a financial penalty to stop people from smoking on an airplane anymore. The internalized social norm is doing all the heavy lifting.
Which brings us back to Thomas's core argument about evaluation. If you evaluated that very first indoor smoking ban solely by asking, did everyone in the city quit smoking the next morning? You would have labeled the policy a massive failure. But if you evaluate it by asking, did this policy help create an invisible architecture where smoking is no longer the default social norm?
Then it's an astonishing, world-changing success.
Here's where it gets really interesting, though. Because realizing that a government policy has the power to slowly engineer what we like and prefer over a generation, that opens up a massive ethical trap.
It certainly does.
Because if policies are actively trying to shape our desires, where does public health end and government manipulation begin?
The paper actually dives deep into this clash. It brings in some heavy-hitting political philosophy regarding institutional and policy implications.
Yeah, the philosophical tension is arguably the most important part of the paper.
Thomas contrasts two deeply opposing viewpoints in his references. On one side, he cites Milton Friedman's highly influential book, Capitalism and Freedom. That's reference 11. And Friedman is, of course, perhaps the most famous modern champion of free markets and minimal state intervention.
Right. And on the other side, Thomas points to Gerald Dworkin's foundational work on the concept of paternalism, which is reference 4.
For those who might not be familiar with the term, in a policy context, paternalism is essentially the nanny state argument.
It's the idea that the government is treating its citizens like children, making decisions for your own good because it assumes you simply can't be trusted to make healthy choices for yourself.
Yeah. And Friedman's framework argues that the ultimate social good is individual freedom.
Right. In a purely free market, individuals are allowed to maximize their own utility and pursue their own preferences, whatever they may be.
Any state intervention, whether it's a tax or a ban, distorts that market. It arrogantly assumes the state knows better than the individual.
So if I can play devil's advocate here,
Go for it.
I'm going to put my Milton Friedman hat on for a second and challenge this entire premise.
Yeah.
If a public health policy is explicitly designed, as Thomas argues, to slowly engineer my environment until my preferences align with the government's goals, isn't that the ultimate terrifying form of paternalism?
That's a valid concern.
Isn't the state basically saying, we don't like what you choose, so we're going to silently tweak the architecture of your life until you agree with us? Isn't that a fundamental infringement on my free will and my personal autonomy?
That is the most common and, frankly, the most emotionally resonant criticism of public health interventions. It feels like a direct violation of your personal sovereignty.
It really does.
But Thomas counters this by pulling from a different philosophical tradition. He cites Joseph Ross's book, The Morality of Freedom, and Richard Arneson's work on perfectionism in politics.
Okay.
They argue that our traditional Friedman-esque definition of autonomy is actually incredibly shallow.
How so?
Well, under the shallow definition, autonomy just means the ability to make a random choice. But Ross and Arneson argue that true autonomy is not just picking an option off a shelf.
Yep.
True autonomy is the ability to make an informed choice within an environment that actually offers valuable, transparent options that support human flourishing.
So Ross and Arneson are arguing that a choice isn't truly free if the deck is heavily stacked against you from the start.
Exactly. Let's use a casino as an analogy.
Okay, I like that.
If I walk into a casino, I have the absolute, quote-unquote, freedom to play any game on the floor. I can play blackjack, roulette, or the slot machines.
Right. Nobody's forcing you to pick one over the other.
But the entire environment, the flashing lights, the lack of clocks on the walls, the free drinks, the maze-like floor plan, is highly engineered by psychologists to disorient me.
Right. To ensure that you eventually lose your money.
Yeah. My choice of which game to play is an illusion of freedom because the environment is manipulating my behavior from the second I walk in.
And that casino analogy perfectly translates to the modern food environment.
Take it out of the casino and put it into the grocery store.
Exactly. Are you truly acting autonomously if your preferences were formed by an environment that actively hides the dangers of a product?
Right.
Imagine a child who grows up seeing colorful cartoon mascot advertisements for sugary cereals during every television break.
Yeah, and those cereals are placed exactly at a child's eye level in the supermarket.
They're artificially subsidized by agricultural policies to be dirt cheap. And the product itself is scientifically engineered by food chemists to hit the exact bliss point of sugar and salt.
The precise ratio that overrides the human brain's natural satiety signals.
Exactly. So my free will was already compromised before the government even thought about stepping in.
The choice to eat the junk food is a conditioned biological response.
Mm.
It's not an autonomous, independent decision.
Therefore, introducing a public health policy like a stark black and white graphic warning label or a tax that reflects the true medical cost of that food is not an infringement on your freedom.
The policy is breaking the conditioned response.
It provides a factual counter-narrative to the marketing. It's educating you to the reality of the harm, thereby restoring a degree of transparency to the environment.
The policy is basically the government walking into the casino, turning on the fluorescent lights, and pointing to the exit signs.
Yes, it says, hey, wake up, the odds here are entirely rigged against you.
Which reframes the entire ethical debate. Thomas is arguing that public health policies, by changing the norms and providing this educational friction, actually restore true autonomy.
They educate society so that when you do reach for a product, you're making that choice with your eyes wide open, free from the invisible engineered defaults that were quietly making you sick.
This exploration of the rigged casino environment transitions us perfectly into our system-level reflection.
Right.
Because if we accept that our norms and preferences are constantly being shaped, and we zoom out from the government's role, we have to look at the other massive players on this battlefield.
And it is absolutely a battlefield for human attention and preference.
Thomas uses a very specific structural keyword in the paper to describe this opposing force, the commercial determinants of health.
Right. He points specifically to reference 14 for that, a landmark piece by Kickbush, Allen, and Franz.
My major takeaway here is that the narrative of individual willpower is essentially a smokescreen.
It really is. When we look at the explosion of non-communicable diseases, and Thomas specifically cites Buchanan's work on obesity and justice in this context, we can't simply blame individuals for lacking discipline.
No, because our choices are relentlessly bombarded and influenced by massive commercial interests.
The commercial determinants of health refer to the myriad ways in which the private sector actively designs our physical, social, and cultural environments to maximize profit.
Often at the direct expense of public health.
We're not just talking about traditional billboards anymore either. Think about the sheer scale of data harvesting and algorithmic advertising used today.
Corporations track browsing habits, location data, and behavioral patterns.
They use that data to serve a hyper-targeted advertisement for a high-calorie, ultra-processed food delivery at the exact time of day. Your willpower is statistically at its lowest.
They're basically funding their own multi-billion-dollar, highly sophisticated, invisible curriculum.
And that realization is the crux of Thomas's entire thesis. You simply cannot view public health policy as an isolated intrusion into an otherwise neutral, peaceful market of independent thinkers.
Because the market is not neutral.
Exactly. It is aggressively weighted by commercial determinants that are actively educating us through omnipresent marketing, product placement, and chemical engineering to prefer the exact things that cause chronic disease.
It makes me think of a high-stakes courtroom trial.
Okay, how so?
Well, the commercial interests are acting as the prosecution, armed with billions of dollars, making a highly persuasive psychological argument for why we should consume junk food, alcohol, and tobacco.
Right.
And the public health policy is acting as the defense attorney, stepping in to make the counter-argument for our long-term health and survival.
I like that. And to tie it back to the very beginning of our deep dive, if we only measure the success of the public health policy by asking, did the jury change their mind immediately after hearing the opening statements?
Then we completely misunderstand how the justice system works.
Because the trial lasts for decades. The jury, which is society as a whole, is slowly shifting its verdict over years of hearing the arguments, seeing the warning labels, and experiencing the changing environment.
It demands a complete paradigm shift in how we judge the rules we live by. We have to stop evaluating these critical interventions through the lens of instant gratification.
Exactly.
So what does this all mean for you listening right now? The ultimate takeaway is to change the way you process the news.
The next time you see a headline about a controversial new health tax, Or a restriction on how junk food can be marketed to children?
Or a new zoning law about fast food drive-thrus, don't ask the obvious short-term question. Will this change my behavior tomorrow?
Stop judging public policy like a daily weigh-in on a crash diet.
Instead, look out at the horizon. Ask yourself, how is this policy attempting to educate society's norms for the next generation?
How will this small point of friction today change what my children or my grandchildren consider to be a completely normal Tuesday afternoon snack?
These policies aren't just putting out temporary fires. They are building the invisible cultural architecture of the future.
It powerfully reframes the entire narrative from a state restriction to cultural construction. We're not just limiting bad choices, we are deliberately constructing a culture where the healthy choice gradually becomes the effortless default preference.
But tracing all these invisible forces, both the government policies and the corporate algorithms, leaves us with an incredibly profound and maybe slightly unsettling final thought.
It certainly does.
Because if our daily preferences are constantly being molded either by the slow educational arc of public health interventions aiming to protect us, or by the relentless, hyper-targeted commercial interests aiming to sell us products.
Is there really such a thing as a purely independent, autonomous health choice?
Or are we, in the end, always just a reflection of the environment that built us?
That is a heavy question to chew on the next time you reach for something in the checkout aisle.
It really is. Thank you for listening to the GMJ podcast.
For a full and detailed discussion of the topic presented in this episode, we invite you to consult the original article published in the Georgian Medical Journal. A direct link is provided in the episode description.
We look forward to continuing these scholarly discussions in future episodes.